I'm so honored today to be interviewing Dr. William Audeh from Agendia. He is a big part of my mission working with Agendia on genomic testing. This is an incredibly important part of a person's breast cancer journey that I did not know about. So it is my mission to make sure people are empowered, not only about their diagnosis, but the power of genomic testing. And so, Dr. Audeh, I'd love to know, why did you and your company decide to work with Learn, Look, Locate?
Oh, well, for me, I've been focused on education for women diagnosed with breast cancer throughout my entire clinical career. I became convinced early on that there needed to be a basic understanding of this complicated illness so that a woman could make all the best choices for herself. There are many choices to be made that are unique to every individual. And without having the basic understanding of what a person is dealing with, I think you can't make the best choices. So for me personally, this was very much an important issue that I've always wanted to be part of. And I think having joined Agendia now 8 years ago, it's been very clear that Agendia is entirely focused on, at this point, early stage breast cancer and in helping women make the best decisions for their therapy with their doctors. We all believe in shared decision making. And to do that, one needs to be informed about the nature of breast cancer and the options for treatment.
So you see the gap like I did as what's going on when a person's diagnosed, that we are not aware and the access to the information is quite difficult. Do you see that?
Oh, absolutely. As you know, Cynthia, before joining Agendia, I was in clinical practice as a breast medical oncologist and clinical researcher for almost 30 years. And in all that time, I spent much time explaining diagnosis to my patients. Before we would talk at all about what to do about it, I would spend quite a bit of time simply explaining what we were dealing with and what the problem was. I think physicians have to be educators first and foremost in order to take the best care of the people that they're caring for. And I think it's also clear that there's a wide range of understanding about breast cancer. Some women would come to me very well informed and very well read, and others entirely without any background whatsoever. I think the era where a woman would come into a doctor's office and say, just tell me what to do, I'll do whatever you think is best. I think we're past that. I think women need to be informed so that they can engage in shared decision making with their doctors.
I totally agree with you. And it's interesting because I'm 5 years out. I look back on what I'm doing and I'm just so grateful that people are finding this beautiful platform, because they can then go into their doctors and really blow them away, because they're asking these questions and they get to know behind the scenes about tests like Agendia and ask for it. And that's what we want to do. So can you explain to me what getting genomic testing means to someone like myself who was diagnosed with stage 2B breast cancer? What does it mean about my tumor? What does it mean about my treatments? I mean, why is this so important?
Yeah. Well, you mentioned the stage of the breast cancer, and everyone, of course, once they're diagnosed, there's a stage applied which really only tells you how large the tumor is or how extensive it is in the breast. It doesn't tell you anything about the nature of that cancer or how to treat it. And for many, many decades, we had a handful of pieces of information that came to us from pathology: estrogen receptor, HER2 receptor, grade, things that a pathologist would detect under the microscope. But even that fell short of telling us exactly what was driving this cancer to grow, how is it going to behave, and what do we need to treat it with. So genomic testing actually gets to the heart of the problem in breast cancer. It's the genes, it's the DNA that's telling the cancer cell what to do,
Mm.
how to grow, and how to behave. And the more we understand about those genes, the better we can precisely tailor treatment for that individual woman and her individual cancer. Because it's at the level of the genes that we understand the most about a breast cancer so that we can target its weaknesses as best we can.
So genomic testing really does unpack a treasure chest of knowledge
Yeah,
because there's a lot behind all of it.
absolutely. And the challenge up to recently, of course, has been how do we get at that information?
Yes.
Because you can't see it under a microscope. You can't see it on any kind of a scan. You need special technology to get down to the level of the genes. And that's what we do when we perform genomic testing on a tiny cancer sample to learn as much as we possibly can.
So does a breast cancer patient ask for this when they're diagnosed? When does all this happen? How do we know when can we get it?
Yeah, that's a great question because that's been changing. Of
Mhm.
course, I think a person with breast cancer is entitled to ask for whatever test they have learned about and think will be helpful to them. Of course, many clinicians are familiar with this technology and have integrated it into their routine processing and analysis when someone is newly diagnosed. What's changed, however, is the nature of the information that we can actually extract from the genomic testing. It used to be that the only question that genomic testing answered was whether a woman needs chemotherapy or not.
Mhm.
That, of course, is a huge question. It's probably the major question,
Sure.
but it's not the only one. There are many other questions that we can now answer with this information. And so it starts to push the need for this information earlier and earlier after diagnosis, because we can do this genomic analysis on the same biopsy that made the diagnosis. We don't have to wait for surgery to take the cancer out to do this kind of analysis. So we
Wow.
can give this information to a woman and her doctor within days of a diagnosis being made so that all of the decisions that need to be made can be informed by this genomic information.
So when I got a biopsy and they told me it was cancer, that biopsy could be tested and would have been able to tell me all of this? Is
It
that
it
correct?
could it could have told you, and of course this is what we do now. Most of the samples that we now receive in our laboratory in Agendia are on those core biopsy samples, the biopsy that was done to make the diagnosis, because we don't need a very large proportion of the cancer to do this analysis. But besides being able to predict whether chemotherapy is needed or not, we can also, in terms of hormone positive breast cancer, give information as to how long the hormone therapy needs to be given. For those women who need chemotherapy, we're also developing information that helps select which chemotherapy may be best. So there are a number of questions that can be answered. And probably the newest is to help decide whether treatment should be given before surgery or after surgery, because that, of course, is another decision that has to be made almost immediately after diagnosis. And there are many women who benefit from having treatment given before surgery because a lot of information can be gathered by doing that.
Neoadjuvant chemotherapy.
Neoadjuvant therapy, yes.
Wow. So I did not know any of this. I did not get genomic testing until after my double mastectomy, and I had to ask for it. It wasn't part of the plan. And one of the reasons why I was able to get it is because I did have a micrometastases, a small amount of cancer cells in my sentinel node. Now, if I had had clear margins, would I have been able to get genomic testing? Can anyone get it?
Yes, it's appropriate for really any woman who is newly diagnosed. Now, as you know, there are different kinds of breast cancer that we classify based on pathology, the most common being hormone positive breast cancer. And I think at this point, the genomic testing that I've been talking about is most useful for women whose cancer is estrogen positive or hormone positive, because there are many choices to be made there in that type of breast cancer. Genomic information is helpful for HER2 positive cancers and even for triple negative breast cancers, but not as helpful as it is now for hormone positive breast cancer.
Percentage, if you had to guess, of breast cancer patients are getting genomic testing right now?
Well, I would say for those who are the best candidates, the hormone positive breast cancer that is in the early stages, I'd say it's probably no more than half, probably even less than half.
That's
And you could certainly ask why is that? And you've already provided one answer. It's that it's left up to the clinician to decide when to use it, and they will only use it if they understand what it will or will not answer. They need to be as educated about this technology as the woman with breast cancer does, because it's changing all the time, and they're not going to get that information unless they understand how important it is.
so how is a doctor prescribing chemo based on not knowing the genomic and the testing?
Well, that's a good question. Obviously, there are cancers that we know need chemotherapy automatically, like triple negative breast cancer, HER2 positive breast cancer. But for hormone positive breast cancer, that is a question that cannot be answered easily without genomic information.
I will tell you, Dr. Audeh, that to me, this is so, I'm going to use the word upsetting, because it's unfair that this information is not in the hands of people to be empowered, because this information can really give a sense, at least it did for me, a sense of calm, because I truly got a chance to understand what was going on with my diagnosis and the tumor. But what's also interesting, and I want anyone who's listening to really understand the fact that if this can be done at the time of a biopsy, the amount of anxiety that we go through is through the stratosphere. I mean, the beginning stages, making it very real for anyone listening newly diagnosed, is in somewhat the hardest, because you don't know anything. You don't know anything. So this is really helpful. I hope people are digesting that they can empower themselves to ask for it. So the question would be, how is this covered? Is it covered? Is it part of the breast cancer treatment plan and things like that?
It is absolutely covered by all the major payers and by Medicare. It's been well established to be an essential component of making the best decisions at that critical point when a woman is diagnosed with early stage breast cancer. I always like to point out that the vast majority of women diagnosed with breast cancer are diagnosed at early curable stages. So it's the responsibility of the physician to obviously achieve that cure, but also to do it with as little toxicity as is necessary to achieve it. So the outcomes for most women are going to be very, very good. It's how do you get there? How do you get to that? How do you achieve that cure with as little toxicity as possible, but with the highest likelihood that it'll be effective? You know, something you said just reminded me that, as you said, at the time a diagnosis is made, there's so many things going on in a person's head and heart.
Mhm.
It it's not just coping with the diagnosis of a cancer, but
Mm.
it's also having to acquire some understanding of what that's about and the treatment that it will entail. So it's an extraordinarily difficult and challenging time for any person.
Mhm.
So I do believe that having a clear plan as early as possible is comforting.
Oh,
It does take away some of the uncertainties and anxieties. And that's why we really advocate getting this genomic information as early on as possible and not necessarily waiting until after the surgery is done to find out, do I need chemotherapy or not? That's very much why I chose to leave my practice after almost 30 years to devote full time
mm.
educating my colleagues, as well as women with breast cancer, about how important this information can be.
It is a small window of time. It is like the clock is ticking, and you don't even hear what the surgeon's saying to you when you have that first meeting. You don't. You're so emotionally distraught. So Agendia makes two tests, MammaPrint and BluePrint. So can you explain to me what the MammaPrint test does?
Yes. So the MammaPrint test is the test that we use to determine whether a woman needs chemotherapy or not. It predicts the chance of a cancer's ability to spread. And the
Mm.
higher the chance that it has to spread, the more we believe that chemotherapy is necessary to halt the growth of that cancer. So to do that, we look at 70 genes in a breast cancer and determine how active they are. And that tells us, first of all, whether we think chemotherapy is necessary for that cancer. But as I mentioned, we can actually get even more information out of the MammaPrint than just that. We can also answer questions about how long hormone therapy may be necessary. And for those women who need chemotherapy, we can also provide some information as to which treatments may be the most effective. So the MammaPrint looks at a very specific aspect of breast cancer's behavior.
So let me ask you something about the, because I was estrogen positive. Can MammaPrint tell you right out of the gate if anti-estrogen therapy will benefit you?
Yes, because it's assumed that if a cancer has estrogen receptors, that it is using them to grow. It's using the estrogen hormone. So just how dependent on estrogen that cancer is something that we can predict not only with MammaPrint, but also with our other test that you mentioned, the BluePrint test. Because
So
it's
I
not, I'm sorry. What I
no,
wanted to say was it's not only whether a cancer is sensitive to estrogen, but also how long the anti-estrogen treatment needs to be given to really protect a woman from having the cancer come back, because that can vary also.
but it can determine whether or not you'll benefit from it. Because many women, and I'm on social media quite a bit, are struggling with taking the anti-estrogen. There's a lot of side effects. So when I got diagnosed out of the gate, that was, something I was very concerned about. If I had done this, you're telling me that MammaPrint would tell me whether or not I would have benefited right that from diagnosis, estrogen positive. It could tell me whether or not I really should be taking it.
Well, I don't think I would say that a MammaPrint result would tell you not to take anti-estrogen treatment at all
Okay.
if the cancer is estrogen positive. But we can tell you how necessary that anti-estrogen treatment is in terms of how long to take it. And what I'm specifically referring to is research that we've done and published now, where within the low risk MammaPrint, the group that we believe does not need chemotherapy, we identify a group that we call ultra low risk.
Yeah.
because we've shown that those cancers are really very easy to eradicate, and a woman may not need more than 2 years of anti-estrogen therapy instead of the full 5 if she's ultra low risk. We found that women who were treated with less than 5 years seem to do very well. And so if there's toxicity, we think knowing that a person is ultra low may give you some comfort if you need to stop early. On the other hand, there's a group of low risk women who aren't ultra low, who are the most estrogen sensitive of all. And for them, they really need to finish their full 5 years. And if they can take it longer, they should, because it'll continue to protect them even beyond 5 years. So we're able to give a bit more detail about just how important anti-estrogen treatment should be.
This is incredibly powerful. I mean, for the women out there that are, really, they ask me lots of questions. They write to me. I share my journey, what happened to me, but a lot of them are really struggling. It's a personal decision on, what you want to do and understanding what you're, what are you ultra low? Just the fact that you guys break it down is really helpful, because then I can understand that's my category. This is where I live and I can relate to that, right? So I know you have another test called BluePrint, and I know that determines what's driving the growth of my tumor, correct?
Right.
So that's kind of, so if someone's estrogen positive, you would say, okay, that's the estrogen, driving it, right? Is that correct? So
Well, that's why BluePrint is so important. Because again, we're looking at genes in the cancer. This time we're looking at 80 genes, different from MammaPrint for the most part. These 80 genes are telling us what is driving the growth of the cancer, what's going on inside the cancer, not on the surface where the estrogen receptor is or the HER2 receptor is, but what's going on inside that's driving the cancer to grow, by looking at which genes are active or inactive. So one of the most important things we've found using this BluePrint assay is that there are some estrogen positive cancers that look like they're estrogen dependent on the outside, but when we look inside, they're not. They're actually much more triple negative breast cancers. It doesn't look anti-estrogen treatment would be very helpful to them. It looks they need the kind of treatment that's more appropriate for a triple negative type of breast cancer. And the reason we think this is really critical is that if you don't identify a cancer as that type, it may be undertreated. It may not be treated with enough aggressiveness to be sure that you get rid of it. It's not terribly common, but depending on where you test, what kind of testing you do, it can be anywhere from 1 in 8 cancers to as many as 1 in 4 hormone positive cancers. So we think that going beyond just hormone positive and looking at the genomics with BluePrint is really important to not miss that type of cancer.
So does that help determine the type of treatment? That's my first question. But then I also say, I have a genetic history of cancers, never was genetic tested. It's another part of my mission until after I was diagnosed, go figure. So would the BluePrint test understand the genomics of hereditary cancer of sorts? That's more genetic testing. I'm trying to figure out more of what exactly. I'm going to say something that's patient friendly is, oh, well, mine was caused by stress. Is that what happened here? If I did not do the BluePrint test, which I find to be quite interesting. What else besides being estrogen positive could that test tell me?
Well, it'll also tell us the other types, HER2 positive breast cancers. Not all of them are driven mainly by that HER2 receptor. That, of course, that's the target for drugs, Herceptin, for example, a hugely beneficial drug for those types of breast cancers. But again, when we look down at the genetic level, we find that some cancers are both hormone positive and HER2 positive. And we can use the blueprint to tell us, well, which pathway is really in the driver's seat for that cancer. Is it the estrogen or is it the HER2? Both
Ah,
treatments are needed, but there are many choices as to just how hard to push in one direction or the other. So that can be very helpful as well.
yes. So can a person ask for both MammaPrint and BluePrint?
They're run at the same time on the same sample, the same machine in our laboratory. They do need to be ordered separately, but I would say 90% of the samples that come into our laboratory, they are both tested. And of course, we learn the most when we have both of those tests in our hands.
Yeah.
And the result that we provide in our patient summary report integrates those two tests to categorize breast cancers.
And who do we ask? Our oncologist or our breast surgeon? Who does
Either
either
I,
one?
either one can order these tests. It's a very simple ordering process. And as soon as there's a cancer sample in the pathology laboratory, it can be a portion of it can be sent to the Agendia laboratory.
Wow. Tell me about risk of recurrence. That is the big $1 million question on all of our minds. And, we struggle with understanding. If we can't get a PET scan, how do we know? So tell me how your test can help with that.
Yeah. Well, at this point, we don't have a blood test or a scan that can tell us for certain whether any cells escaped from the cancer in the breast and spread elsewhere. That's, of course, the risk of recurrence that we're all trying to prevent by tailoring treatment after diagnosis to make sure we've gotten rid of everything. We know the surgery can take the cancer out of the breast and that the radiation can kill any remaining cells that are in the breast. But what about the cells that might have escaped, gotten into the bloodstream or the lymph system and gone elsewhere?
Yes.
We don't have a test, as I've said, that detects whether those cells are there, at least not yet, but we can predict whether that happened. That's what I meant when I said that MammaPrint predicts the risk of recurrence, the chance of spread. By looking at those 70 genes that I mentioned, we get a sense of whether a cancer has the machinery to spread. Does it have the capabilities? Some do, some don't, and they have them to greater or lesser extent. So that's what we report. This is a cancer that has a very low likelihood of spread, or this is a cancer that appears to have the machinery to be able to spread pretty quickly. So let's tailor our treatment accordingly to do the best we can to eradicate those microscopic cells that we can't detect any other way.
So powerful, so incredibly powerful. 5 years ago, to have this in the hands of a newly diagnosed person so they can go in and ask for these tests and then ask their doctor to really help them understand it in a patient-friendly way. Remember, all these terms, I know what they are, but even I struggle with, really breaking it down so that people understand what is HER2 positive, what is HER2 negative, what is estrogen. It's still mind-blowing that estrogen is something a woman needs, yet it could have killed me. So that's a whole nother topic, but I have a few more questions. What's the difference between genomic and genetic testing?
Yeah, a great question. And as I was mentioning earlier, in my many years of practice, I was an early utilizer of genetic testing, which is usually the term that we use to refer to detecting genes that a person inherited or is born with
Yeah.
that might predispose them to breast cancer, or in the case of the BRCA genes,
Yes.
breast cancer or ovarian cancer. So when we talk about genetic testing, we're primarily talking about not testing a tumor, but taking a blood sample or a saliva sample and looking at the genes that a person was born with
Mhm.
to see if we can detect some of those important genes that really raise the risk of a woman developing breast cancer sometime in her lifetime. The BRCA genes 1 and 2 are the best known and most famous. There's a handful of others that are very easily tested for now. And so I was always a very big advocate of any woman with any family member with breast cancer on either the mother's side or the father's side
Uh-huh.
should really look into that, because finding out that you may have a higher risk will change your approach to screening.
Oh, yeah,
It could really make an enormous difference. It could be life-saving.
sure.
So that's genetic testing. Genomic testing is what we do on the cancer sample itself
Okay.
to look at the genes inside the cancer to tell us, as we've been discussing, how to treat it.
I have a question. Does the same for genomic testing, how about with men for breast cancer? Same?
Yes,
Just same? Okay.
yeah,
Just thinking.
we perform this on male breast cancer as well.
That's great. And it's a big part of what I'm doing here too. I do not want to leave men out because they do get it.
Yes.
Rare. Any final thoughts? This is just incredible. And I can't wait to get this out to the world because I know globally. What if I live in Switzerland or France or Germany and I'm watching this? Can I get this test? Or
Yes,
Australia?
this test is available all over the world. I was just in Berlin just last week at the European Breast Cancer Conference where we presented data using MammaPrint and BluePrint. Um,
Wow.
so it is available in many countries throughout the world. Unfortunately, each country has its own health policy and health system.
I was gonna
Uh,
say.
some are willing to spend more than others on tests such as this. So I would say that any woman anywhere in the world who wants to get this test can, but each country has its own rules and limitations. So it's covered in some countries and not so in others. But I'm, very proud to say that women in Brazil are tested, women in China are tested, women all over Europe are tested. So there's really no limit if a doctor and a woman or man with breast cancer feels like they would like to get this information.
So by working together in what we're doing, our goal is to get this out there globally. There is no reason why anyone, wherever they are on this planet, should not have access to the information to help them understand, their treatment and their diagnosis. So I'm really excited that we're all working together to turn the knob up. That's my goal.
Well, I so appreciate having the opportunity to talk with you about this. You mentioned the global issue.
Yeah,
Breast cancer, unfortunately, is not going away. The
terrible.
numbers are still increasing. We're
Oh,
certainly doing much, much better than we were, but we still have a long way to go. And we believe that digging into the genomic information more and more will help us make the further improvements that we really need.
the amount of young women that I see getting diagnosed is unbelievable. I mean, by putting myself on social media and seeing it hurts my heart so much because they do not have access to anything. This is not on their minds. So the least we can do is, if they're diagnosed, to be able to be empowered because there's just their whole lives are beginning.
Yeah.
Young families, fertility, all of it. So I'm glad you brought that up. It is a big part of my why. So, well, thank you, Dr. Audeh. I am beyond grateful for this partnership. This information is empowering and life-saving. I mean, it's wonderful. So thank you for what you do. And I'm really grateful that we have this treasure chest of knowledge, this brand new page on Learn, Look, Locate. brought to you by Agendia with MammaPrint and BluePrint guiding you along the way.
Thank you so much, Cynthia. It's really an honor and a pleasure for me to have chatted with you today, and of course for us to be part of your extraordinarily educational and important website. Education is the key.